Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
5 best exercises to stop knee pain quickly. What we're going to do is kind of go over different scenarios here and what you want to do quickly to help it decrease the pain, right?
Precisely, Bob. These are, field tested things that we've discovered over the last 30 years of our therapy
Existence.
Right. Yeah, as therapist existence. So we're going to share these with you, and when they work really well. We can't guarantee it's going to work every time, but it gives you some easy options you can do at home.
These are great tips.
Right.
If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free. We upload every day. Also go over to Facebook and like us, because Bob and Brad, if you like us, we like you back.
There you go. It's a
Reciprocal.
Yeah, reciprocating.
Good.
Okay, Bob, the first thing I want to talk about, and this just happened this last week, happened with my mother. It gave me the idea for this. She got up out of her chair, immediate pain in her knee. She could hardly walk for 2 days after that, and we were all concerned about it. And I did
nothing really happened. She didn't fall or anything like that.
No, but it was a sharp pain. So I'm assuming she's 82 years old. I'm assuming it's arthritic changes. Something changed in there.
And I can actually, Brad, this happened to my wife about a month ago,
Okay.
or a month, 2 months ago. She's only in her 50s, and same thing, this pain just started coming on. What can happen is a little piece of the disc, or the cartilage can break off.
Sure.
And it can be like a rock in your shoe.
Right.
And so until it gets reabsorbed, it's really painful.
Yeah.
So she did the exact same things that your mom's
There
did.
you go. And this has happened to a number of people throughout the world.
Yeah.
So the first thing you gotta do as a therapist is don't get excited. Do the easiest stuff first.
Yeah.
So the first thing I did is I had her sit in the recliner, had her put her leg up because it was swollen all the way down to her ankle. We took a cold pack and we wrapped it around there for 20 minutes, and immediately she said, "Oh, does that feel good?"
Yeah.
And I knew right away that chances are things are going to get better, at least partially, just doing some of this.
Sure.
And then the next thing I'd had her do is after the cold pack, or between putting the cold pack on 3 times a day, was simply do kicks, or we call them our quads, and just gently get it moving, support the leg here. We want to get range of motion in that joint as long as it doesn't hurt. And she was able to go about like this to start with.
Sure.
Within a day and a half to 2 days, she had full range of motion all the way straight. Things were feeling much better.
Starting to get that synovial fluid going, you're smoothing out the joint,
Right.
you're getting some more blood flow to it. So, and then the third thing, this is the one that my wife balked at, is by all means, and until it got so bad that she had to do it, is to keep some of the weight off of it.
Right.
And a lot of times that alone will help it calm down. So what do we mean by keeping some of the weight off? You're gonna have to use some type of crutch or gait aid. So, and again, believe me, all of our patients always fight us on this.
Right.
I mean, I'll just say, just for a while, I want you to use a cane or a crutch. A lot of times a crutch is better because it seems a little less elderly.
Right, especially if you're a younger person in your 40s or 50s or even younger, it's like you're much would rather be seen with a crutch than a cane.
And, get ready, you're gonna have to tell the story what happened. That's what my wife hated, is that she, people thought she was injured, and it's like, the knee just started hurting.
Right.
But she was forced to the point where she had to use a gait aid, and it did help.
Sure.
And, eventually we also got like a walking stick that she'd use outside.
Sure,
So,
yeah.
and sometimes you wanna go ahead, it was funny how quickly her arms got sore. We did buy some padding for it.
Sure.
These are little extra padding you can get on the hand and underneath the arm here, and it really made a big difference.
Sure.
So.
Obviously, that's not adjusted for Bob, but we're not going to get into that with this because we got other things to get to. But we got
So that 3-step program right there will help like a traumatic event that just comes out with
right. Now this next situation is someone, if you walk a lot, run or bike, and after a period of time, 10, 15, 30 minutes of doing the activity, the knee starts to hurt. And it seems to be kind of a joint pain, and
A
it'll
lot of
go,
times on the outside of the knee.
Right.
That's where you're feeling it.
and it'll go away when you give it rest and you put a cold pack on it. But every time you do the activity, and after a certain period of time, that knee pain comes back. And oftentimes it can be a tight IT band.
Right.
This is a nice stretch, easy to do.
So the IT band comes all the way down and crosses the knee.
Right about where
Yeah.
the white stripes are.
And so when you do a lot of flexion and extension of the knee, like with biking and running, that can get irritated on the side of the
Right.
knee. So that's what we're thinking here is going on, so you're gonna wanna go ahead and stretch that.
So you can just cross like this, or you can do it here. And we're just gonna simply pull this over in this direction so you feel the stretch. And a lot of times you may not feel the stretch in the knee, you'll feel it up here in the hip. But that's part of that muscle belly from that TFL, the muscle that connects to the IT band. And we're just gonna stretch it, hold it for 3 to 5 seconds, and do that 5 to 10 times, at least 3 times a day. And this is one that, we had a video.
Yeah, we had a friend, Brad has a friend that actually, this one simple exercise alone took away his knee pain, and it was disabling.
Yeah, he was
having trouble walking.
Right, and now he does marathons on a regular basis.
Ironman.
Yeah, exactly.
Yeah.
Number 3, pain in the front of the knee, around the kneecap.
Yeah.
Particularly if you're going up and down stairs or walking up and down hills, you may feel it more so. Bob, do you want to show you guys?
Yeah, I don't know, can you focus in on me here?
Look at those legs.
Yeah, that's something you've seen better on a kitchen table, right? So a lot of times if you're having pain, again, going around the kneecap, you're gonna wanna go ahead and mobilize that kneecap, because quite often what we find is that it's tight. And especially tight into this direction.
Sure. Now, when you do this, you really have to learn to relax your quadriceps.
Yeah, it's an icky feeling. A lot of people don't like it, but by getting more, what's quite often is happening is the kneecap can be too far over like this, and it's rubbing underneath the kneecap, and it's irritating it. So by stretching it here, so again, usually stretching it out that way is the number one way to do it, but you can actually stretch it both ways.
Right.
And you can also stretch it down. You're stretching it globally, as we say.
Right.
And I can also stretch it up. And just by loosening up, a lot of times it'll maybe reposition itself. You may have to tape it if it doesn't want to stay in place, and that's beyond your skill level. You're gonna have to have a therapist.
Right. So you're going to do this at least 3 times a day. It should feel, like a little bit of a stretch, maybe a little pain, but as you do more of it, it should improve. So if you do it 3 times a day and spend about 2 to 3 minutes stretching it all 4 directions, and see what kind of response. This is one that it's amazing. When it works really well. If it doesn't work, you have nothing to lose. It's not going to.
I think I was wrong in saying that, Brad. That's not stretch laterally. Usually it's medially because it's tight on the lateral side.
Yeah.
So usually the one stretch you really want to do is pushing towards the other knee.
Yeah, you caught yourself
I
out.
caught myself, yeah.
And I was thinking about the next knee thing to go to, but I'm glad you caught yourself. But either way, it's a good idea.
It's good to stretch it both ways.
Yeah.
And I had one lady, Brad, that actually, it would hurt on the stairs. And so what she'd do is she'd push the kneecap over while she's going up the stairs, and then it wouldn't hurt.
So she'd literally hold it with her
hold
hand.
it over.
Yeah.
And it works. So that just shows you the magic of that. Sometimes you get it back in that canal where
Right.
it's supposed to be.
Right.
So. All right, what's next, Brad?
The next one, a lot of times, it's probably due to arthritic changes, but pain with walking. It gets worse with walking the longer you walk. And this is just, let's do it with your, why don't you bring that stool? And just check and see if you have full range of motion with knee extension.
So what you're going to do
straight knee.
is you're going to put both legs up.
Yep.
And you're going to put both legs up on a chair like this, and you're going to see whether or not, I'll put this one, are they both flat?
Right.
Or is one of them raised up like this? Maybe they're both raised up like
Sure.
this, and then they both need stretching. But if you're lacking full extension, you're going to want to try to regain that, because every little degree that you gain will help decrease pain in that knee.
Sure.
Full range of motion, we found that's almost consistently works. So this one's the tight one. So what I'm going to do is now I'm going to put this one down. And I'm going to go ahead and I'm going to push on the knee. And this might be too high for you. You might have to start on a lower surface. Sometimes people start on the floor, Brad.
Right.
And they just work like this, and they're going to go pressure on, pressure off, pressure on, pressure off.
And he has his hand above the kneecap.
Yeah, you can actually go up above and below with both hands if
Sure.
you want. And we have people do this every hour. The first day I usually only have them do it once.
Right.
Because I had one guy that just went crazy on this the first day.
He
and
did
was,
too many reps.
He was so sore the next day, and he was like, mad at me, he wasn't gonna come back, and then finally got him to come back, and it got better.
Right.
So,
Yeah, so be gentle initially, and you'll notice it may take a few days to get that extension to become like the other one.
it may take a couple months, I mean, if you're really tight.
Right,
So-
it all depends on, you know, if their arthritic condition or if your hamstrings are tight as well. So, all right, Bob, now the next one, you do, well,
Okay.
you wanna do this one?
Sure.
Because you got your shorts on, you wanna show, if your knee,
Just if you don't have the full bend in the knee,
let's say this knee I could pull up and it bends normal, and then you test the other one and you get about to here and you can see there's more range that's available and it kind of hurts, and so we want to see if we can regain that motion.
this was the case with my wife, lacking knee flexion. So what we have her do is, now this is quite high because I'm tall, but if you're shorter, you can put it on a lower chair.
Right.
But you're gonna put your knee up, and we're gonna work on flexion. Now you can just even work on it this way.
Sure.
But usually what helps is you actually take your hands and you're gonna turn the bone here. I'm gonna turn it, this is counterclockwise, right, Brad?
Yeah, for you looking down?
Yeah, so I'm turning the bone and I'm holding it in place. I'm not letting go, I'm turning, and now I'm bending the knee at the same time. This one has worked magic with some people. Not everybody, but some
Right,
people.
yeah, and you're gonna know because when you put that rotation on there and you do it, it goes farther with less pain.
It feels better,
Right.
right? Then you know you're doing the right thing. Now, this is counterclockwise. If you're doing the left leg, it would be clockwise.
Okay, so,
You're going this way and going in.
so you're rotating that way, it'd have a tendency to make your toe want to point inward.
Right, right.
Okay.
I'm internally rotating the
Yeah.
tibia here is what I'm doing.
And repetitions, you're gonna do what, 5 to 10 of those?
5 to 10, and again, you can do them quite a few times a day if you want.
Right.
You can spread them out throughout the day.
Sure, and again, it should continually feel better each time. So with the towel rolled up, not too thick, 4 or 5 layers, you can put that right in the crux of your knee. We call it the popliteal fossa.
Fossa,
Yeah.
fossa.
So we're just gonna put that up in there tight, and this is gonna not get too aggressive, but then we're gonna go like that. What that does, that helps gap the joint a little bit, and sometimes just doing that with that support there will allow that knee to mobilize, and then you take it off, and then voila, you have more flexion.
I'll have to have my wife try that one. I haven't had her do that one.
Yeah, so these are all things you're gonna try. When they work well, they work really well. It doesn't work 100% of the time, so follow the guidelines. It should feel better after you do it, and hopefully while you do it is oftentimes the case.
Thanks for watching.